How should I manage my mental health? The trauma from your dissection and hospital stay will likely have an impact on your mental health and cause you to experience a higher degree of anxiety than normal. Some of the more common post trauma mental health experiences include anxiety, depression, sleep disturbances, and post traumatic stress disorder. Additionally, these symptoms can be exacerbated by post perfusion syndrome, sometimes known as pump head, that people experience after being on bypass. Symptoms include confusion, fogginess, lack of mental agility, among others. This is discussed further in a later section. There are several self help methods that can help you cope with your symptoms. Sometimes people may have persistent symptoms that may require professional help from trained counselors and therapists. If you have symptoms that have persisted despite trying self help methods, it is important to seek help. You can do so by asking your primary care physician for a referral. If you are in crisis, please dial 988 to speak with someone at the National Crisis and Suicide Lifeline. Quote, you didn't choose to have aortic disease, but every day you do get to choose your attitude about how to live with it. Choose hope, choose joy, choose to not let it define you. Sandra G. The main mental and emotional effects you may experience are trauma related difficulties. It is normal to experience some trauma-related symptoms following discharge from the hospital, for example, related to the aortic dissection and/or experiences in ICU. Most patients experience a degree of anxiety, while some patients have short-term mood changes, anxiety, and adjustment to their new circumstances. They eventually get better. Several others may go on to develop post-traumatic stress disorder, PTSD, major depressive disorder, and anxiety disorder. Over 50% of people will have at least one symptom of PTSD following an aortic dissection. These symptoms are divided into several clusters. When these clusters occur together, they suggest a diagnosis of PTSD. These symptoms may appear over time and intensify. Number one, intrusive memories, recurrent and unwanted memories of the traumatic event, reliving the aortic dissection as if it were happening to you again, or as if you were in the hospital or ICU again. Having nightmares or physical reactions to something that reminds you about the traumatic event. Number two, avoidance, avoiding places, people, and activities that remind you of the aortic disease. Number three, negative changes in thoughts and mood. Having negative thoughts about yourself and towards the people in your life. Feeling emotionally detached and distant from your friends and family. Having feelings of hopelessness and difficulty experiencing positive emotions. Having memory issues, including difficulty remembering aspects of the traumatic event. Number four, changes in physical and emotional reactions, becoming easily startled or frightened and always being on guard. Engaging in self destructive behaviors, feeling overwhelming anger or aggression, having difficulty sleeping and concentrating. It is important to be aware of your symptoms and seek help from your PCP if you notice that you are experiencing any of these symptoms. Your PCP can refer you to a clinician such as a psychiatrist, psychologist, or social worker who can then address your symptoms appropriately depending on the level of care you may need. The recommended psychological therapies for PTSD are trauma-focused cognitive behavioral therapy, eye movement desensitization reprocessing, EMDR, and narrative exposure therapy, NET. For more information, see the resources section at the end of this patient guide. An excellent introduction to CBT for PTSD is provided by the Psychology Tools website. See the resources section. The booklet they publish includes a short self-test to give you a better idea of whether your condition is PTSD or not. The booklet also covers some of the basics of the methods used, including grounding to cope with re-experiencing and finding ways to still do the things that matter to you while you manage symptoms of PTSD. When possible, we recommend that you see a qualified therapist or mental health professional for the most effective treatment for your specific needs. Anxiety and depression. Not everyone who experiences trauma will develop PTSD. Some people experience other psychological consequences as well, including depression or anxiety. Some symptoms that suggest you are depressed are persistent feelings of sadness, difficulty concentrating, low energy, changes in appetite, changes in concentration, changes in sleep, sleeping too much or too little, feelings of guilt, not getting joy out of the things you usually enjoy, and sometimes even having thoughts of not wanting to be alive. Symptoms of anxiety can accompany feelings of depression and can include excessive and persistent worry that may affect your functioning and mood. If you are affected by these and are struggling to manage, do not suffer in silence. Seek professional guidance and treatment. You can ask your PCP or hospital team for a referral for assessment by a mental health professional. There is a good evidence base for psychological therapies helping with anxiety and low mood. Some people benefit from combining antidepressant or anti anxiety medication with psychological therapies. It is helpful to locate other people that have been through an aortic dissection. You may consider attending virtual private support group meetings. Aortic Hope offers meetings for both survivors and caregivers. You may register for free. To receive information on dates and times, see the back cover for how to register. Emotional self-help. If you are reading this guide, you realize that you are not alone on your aortic dissection journey. Many other people are on the same journey and would love to talk with you and help you. You can find these people at Aortic Hope, aortichope.org, or our Facebook page, which is run by survivors for survivors and caregivers. Contact us and benefit from being put in touch with others who have been through similar events. See the resources section at the end of this patient guide. 2 techniques from CBT can really help reduce your anxiety and stress. They are progressive muscle relaxation and relaxed breathing. The resources section has a link to the Psychology Tools website page on progressive muscle relaxation and relaxed breathing. There are also other internet resources and mobile phone apps which can assist you with self-help. See the resources section.